My year as chairman, patient safety was high on our agenda, and it certainly became one of Doug's focus points. And I think his history at Columbus is significant and evident of that. Reimbursement was always an issue, and there's different segments of that were on the table during those years. Patient advocacy, legislative advocacy, all of those were ongoing opportunities to collaborate and to work together with various people of the community and the different agencies that we associated with as an association. The Healthy Indiana Plan, as I recall, during that period of time was an opportunity for all of us, not only in the hospital, but certainly at IHHA at the time, and Doug, to get more involved in advocacy efforts and increase our effort and visibility in that regard.
The biggest issue that I think demonstrates Doug's leadership happened to us in 2008 primarily because of what's called, or was called in Indiana, the DISH program. Federal budgets were very, very tight, and state budgets were tight. So the size of the DISH pie that we supplemented Medicaid payments to hospitals from in the state of Indiana shrunk. And for many hospitals, having that DISH payment meant the difference between breaking even at the end of the year or going into the red. And I think it was because of Doug's excellent leadership that we were able to get through that issue. I think what that illustrates about Doug's leadership is that I don't know of anyone who did not trust Doug. And to me, trust is the foundation of effective leadership.
In 2009, we were clearly in the throes of a recession, and so budget cuts. State was not meeting their demands in terms of the tax rolls, and so everyone was looking for hospitals to cut their expenses, cut their reimbursement. And I think we were continuing to say, wait a minute, let's not make this dialogue about finance. Let's make this about how should healthcare be organized and delivered and financed around outcomes. And so I think that's what I recall in 2009, the association, all the Indiana hospitals, we were really trying to say, let's stay focused on the patient. Doug's leadership style has always been based, he is a servant leader. I mean, he believes that Hoosiers deserve the best care, they deserve preventional care, but it's to serve. And I think that's what Doug challenges me personally and all of our leadership, was that we can do better. We can make our health delivery system better, and that's because we have the incredible honor of serving our patients and our communities. And that's what I respect out of Doug's leadership style.
Doug always was looked up to by many of us that were just a few years behind him. He was always an extremely professional, great decision maker, and was a good role model for many of us who were just a few years behind him in the MHA program. There were always challenging issues for the association to deal with, so it was not unusual to have difficult issues to deal with. But rallying people around a common cause, around educating legislators, around advocating for the need for appropriate payment for our Medicaid services that we provided was a big deal. Doug was excellent at that. Doug knew the hospital business, which I think was key as we talked with legislators and trying to help them understand the imposition that a cut in the Medicaid reimbursement was going to be. Doug has been the ultimate and true professional throughout his career, not only at Columbus Regional and the work that he did and led down there, but also at the association level. This industry and this association will miss him a lot in his retirement.
We used to come to the VHA central meetings together in Indianapolis 3 or 4 times a year. And it was always Doug who brought the latest and greatest ideas. Everybody looked to Doug to say, what are you doing in Columbus? He always centered on the patient. Sometimes we would get talking about reimbursement, we'd talk about physician relationships, but he was always the one who came back and said, what can we do to improve patient care? And this would be in a big group setting, and so it was always something that I've held very true to the culture here at Deaconess. What would Doug say? It's all about quality and introducing quality measures. And again, Doug helped us to direct our attention to what it means for the consumer in terms of looking at quality measures to make a better informed decision about health care. It was something new to us. We were always talking about negotiating at the table, but Doug reminded us it is about patient care, it is about quality measures, and we have nothing to hide. In fact, he was the one who really emphasized to us at the board level, what can we do together to improve health care, improve the patient experience, and really work as an organization to not compete on quality, but to really look at improving quality, and that I will always remember that.
As I think back to 2012, it was a year of the Affordable Care Act. We also knew it was a year of a gubernatorial election. So a large degree of uncertainty and awareness that these changes at the federal level with the Supreme Court's decision, the governor's election, and then the outcomes of the various legislative battles throughout the state could create pretty dramatic changes for us in the healthcare industry. Some of the characteristics of Doug's personality and his style that I've really grown to appreciate is that he is a thinker who's very diverse, and he likes to bring together a wide group of people to assess a situation, and he intentionally brings in alternative thoughts and opinion about various matters, which has been very helpful in his role within the association.
The phrase hospital assessment fee says nothing. Sounds like a tax, right? But the hospital assessment fee paradigm was a way to fund expanded care in Indiana and to help reimburse hospitals for the care they gave to the underserved where the reimbursement was poor. So although it sounds like money, it's really about providing care. And Doug was an excellent spokesperson, both at the policy level and at the operational level, in explaining a highly complex subject where most everybody thought that everybody else was getting more than they should, and they were getting less than they should. I mean, everybody. Doctors, hospitals, nursing homes, everybody. So Doug led us through that thicket. I just happened to be part of the team and ended up being part of the assessment commission at the state level. But Doug was an excellent provocateur in developing the policy, a superb author in writing the policy, and a great captain of the ship in implementing the policy.
It seemed like the process for HIP 2.0 went on forever, and I'm sure that Doug and Brian and Tim and others directly involved felt like it was never going to end. And at times it seemed like it may not happen. So I think it was really Doug's persistence in that whole process and his ability to collaborate with the state and really understand what other people were thinking that didn't see that HIP 2.0 was the best thing. But I think Doug just has such a great leadership style that can work not only with hospital CEOs across the state, but with legislators and with the staff. He's assembled a really great team, and he's been a great captain for that team.
The thing that impressed me most about working with Doug and Brian and the individuals from IHA during the price transparency debate was the fact that they wanted to hear from the hospitals. So Doug's leadership really made sure that it was driven by the individual hospitals and that those were our patients, and we needed to respect what our patients wanted to hear from us as hospitals and a group of hospitals or a community of hospitals in terms of the price transparency. You know, it wasn't just satisfying a need from a legislator on what they wanted to see, it was taking back to the individual communities and what their patients and their communities wanted. HIP 2.0 during that year whereas price transparency was more of an individual community effort. HIP 2.0 was more of a statewide effort. So I really valued Doug's leadership in making sure that our voices were heard on how HIP 2.0 was going to impact each individual community hospital and system of hospitals, but really letting Doug and the individuals from IHA drive that with the legislators and drive it with the governor's office, because it was a very technical matter. So Doug's leadership really helped us out in getting that passed. And across the community, across the state, individuals have been impacted positively that now have insurance that didn't have insurance and access to care before. You know, Doug is a hospital CEO. Even though he's been the CEO and president of IHA, he's still a hospital CEO, and he still cares dearly for individual patients, which is why, both on price transparency and HIP 2.0, he boiled it down to how does it impact individuals.
Whether you're at the local level, at a state level, at a national level, dealing with other associations, Doug befriends all. And he has this great respect wherever we go, and that makes him working with our issues easy. You know, everything's simple, everything runs on time. There's no controversy, there's really no animosity. And then the closer you get to Doug, you find out why. And it's because he has phenomenal relationship skills. He has wonderful vision. He anticipates so well all the various parties that need to come together to make something happen. I ask my peers, when they ask me to be the chairman, if they would support us trying to really take a leadership position to improve the health metrics, improve the healthiness of our citizens. And convincingly, 100% said yes, we're here. We know we can't do that on our own, but we know collectively we have influence within our respective communities. So then I reached out to the Indiana Chamber leadership, the Indiana State Medical Association, to the Richard M. Fairbanks Foundation, to Anthem, to the IU School of Public Health, and said, can we all work together? And you know what? We've made a lot of progress. And I know that none of this happens overnight and none of it's certain, but I do think we've launched something that will continue to resonate for many years to come.
Well, I'll have the opportunity to work with Doug in his transition, so I think that's going to be interesting, and hopefully he'll keep me on track and out of trouble. You know, I think it's this is I've said this many times, this is the best time of my career in terms of the changes that are taking place. We talked about a broken system. It's still a long way from being fixed, but access has improved for millions of people across the country, and that's certainly the case here in Indiana. There are movements afoot as we move into population health management and move from volume to value that really do benefit patients very powerfully, and to have a voice in that process is very gratifying, frankly. Yeah, so I'm excited to work with my colleagues across the state and improve our healthcare system. Doug has a connection with our system that goes back at least 50 years. More so, he went to school at St. John the Baptist in South Bend. And I don't know if he went from 1st to 8th grade, but his 8th grade teacher, Sister Marilyn Oliver, I just left, I had lunch with her here. There was a board meeting here on the campus. She was a corporate board member, and she wanted me, I told her what I was going to be doing this afternoon. She wanted me to commend Doug on his wonderful performance during her mental arithmetic quizzes. So apparently he was a numbers whiz in the 8th grade, so he did very well. But she tells me that he's about 50 years overdue for a couple of book reports. So that was 1966. It's 50 years later, and she's still looking for a book report or two from Doug. So he could attend to that in his retirement.
As I look back at Doug's involvement with Indiana Hospital Association, IHHA, his predecessors, Mr. Tukolsky and Ken Stella and Doug, and then moving forward, I think it's interesting to note they all had their own styles. And I remember Mr. Capone, Vince and I talking at one time about everything that Doug brought to the table. And in conversation later with Doug, he had made the comment to me, and it just sort of stayed with me over the years that I'm kind of not sure how I'm going to be able to follow in Ken Stella's footsteps. There's no easy response to those kind of questions. But I think what I tried to share with Doug was, don't, be yourself. You did a great job at Columbus. We all know that. Your priorities are in the right place. Just be Doug. As we look at Doug moving forward and whoever comes in as his successor, I think that person's going to ask the same question, how do I fill the shoes following the footsteps of Doug Leonard?